Hi, I'm Yoni Angeli P. Camarata, a first-year nursing student from Davao Doctors College, BSN-1 11B. And today I'm going to assess the eye, which is an important organ for our sense of sight. So before conducting the assessment, I am going to review my client's previous medical record. This is done to identify instances of harm to the patient. The second will be to determine the scope of the assessment and prepare the necessary equipment for this procedure. So I'm going to need this Snellen chart or the eye chart, a black ball pen, a pen light, and of course, the opaque card. But before going to the assessment, don't forget to perform hand washing. Good morning, sir. I'm Yoni Angeli P. Camarata, your student nurse for today. Can you state your name, please?
My name is John Michael P. Camarote.
And your birthday?
November 14, 2007.
What would you like me to call you?
John would be fine.
Okay, John, today I'll be doing an eye assessment, so I'm going to check how good and clear your eyesight is. So, of course, to check if there are also certain spots and angles which you have trouble seeing. So, during the assessment, I might ask you to read something, to stand up or sit down and try to light your eyes. Will that be alright with you?
Yes.
Okay, and don't worry, all the results will be documented, and rest assured that all the information given will be treated confidentially. So, are there any clarifications or questions perhaps?
No.
Okay. Are you comfortable with the environment? Is the temperature alright?
Yes.
Okay, so before we start, let me ask you some question regarding to your current health status. So, do you experience any changes in your vision lately?
Yes, when I'm reading something far away, I can see properly because my vision is a bit blurry.
Mm-hmm. And how about any spots or floaters in front of your eyes? Like if you're staring at an object, do you see something floating? It's floating?
No.
Okay, so do you experience trouble seeing at night, John? Such as staring at the object when it's night?
No.
Mm, what about double vision, John?
No.
How about any changes in your eyes, like excessive watering or tearing on the eyes?
No.
No? Okay, that's good. And I assume you don't have any previous problems in your eyes, right?
Yes.
Okay. So, in your family history, John, does anyone in your family have a vision or eye problem?
No.
Okay, no? That's good. So, now I'd like to know a little bit about your social background, if that's okay with you.
Yes.
So, now if you don't mind me asking, what's your occupation, John?
Currently, I'm a student because I can't work because I am underage.
Yes.
So, I'm doing online classes at home.
Okay. Yeah. So that's all. So is everything all right in your home? Are there no any stressors?
Yes.
Okay. Like aside from schoolworks.
Yes.
Okay. How about your friends? How frequently do you see them?
Before we can see each other, but due to pandemic, we can't go outside. So no, we can just talk in social media.
Okay. So for your lifestyle, Jen, do you use any gadgets every day?
Yes, laptop and
What are those
mobile.
gadgets?
My cell phone and laptop.
Okay. And how long do you use your cell phones and laptop, John?
5 to 6 hours.
Okay, a day?
Yes.
And do you somewhat experience eye pain?
Yes.
Mm-hmm. And so John, are you using contact lenses or graded lenses?
No.
Okay. So these are all noted. So can we proceed to the assessment now?
Yes.
Okay, thank you. Now I'm going to check the patient's visual acuity to check how well the patient can see well the letters or symbols at a specific distance. So, alright, John, I'm going to ask you to stand up and stand up 20 feet away from the Snellen's chart. Okay, please stand up. Alright, so what I need you to do is to use this opaque card to cover your right eye and read the letters that you can read on the Snellen chart, and then cover your left eye and then read again the letter, just the letter that you can read, alright? And then lastly, read again the Snellen chart with your both eyes. So let's start. So use this opaque card and read. Try to read the letters that you can see.
A, F, B, T, O, Z, L, P, E, D.
Okay, is that it? So for the left eye, okay, you can see. Okay, try to read again the letters.
A, F, B, T, O, Z.
Okay, now you can use your both eyes to read the letters.
A, F, B, T, O, Z, L, P, E, D, P, E, C, F, D.
Okay, that's good. Now we need to perform the selected vision test if the patient wasn't able to read the top line of the chart. Oh, so okay, John, I need you to tell me how many fingers I am raising. Okay, okay. Same chart. Okay,
1, 4, 3.
okay. Now I need you to tell me what direction am I pointing. So,
Left.
right. One, two. Okay, so now I need you to tell me what direction am I pointing. So,
Right. Left. Up. Down. Me.
okay, it's good. And now I need you to tell me if you could see the light and where does the light coming from, okay?
Yes.
Where does the light come from?
Right.
Right. How about this?
Left.
Okay. Now I'm going to check the visual fields of the patient to detect changes in the patient's peripheral vision. Okay, so now John, I need you to look straightly into my eyes and inform me if you spot my fingers entering your visual fields like this. Okay, and then you tell me when you see it. Okay. Okay. 1, 2, 3.
Okay. 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 Okay.
Okay. Okay, proceeding now, I'll be checking the patient's eyes for alignment and symmetry, and eyebrows for hair distribution and movement, and eyelashes for evenness of distribution. So, John, I can see that your eyes are aligned and symmetrical, and your eyebrows are evenly distributed. And so, can you raise your eyebrows like this? Okay. Can you raise it down? Okay. So your eyelashes are evenly distributed, and I can see that the curls are slightly upward. And now I'm going to check the eyelids for the surface characteristics. Okay, so can you close your eyes? Okay, and your eyelids are symmetrical and have no discoloration, so you can open your eyes now. Okay, and now I'm going to check the lacrimal ducts and glands for swelling, assess the bulbar conjunctiva, and sclera for color and texture. So we should also check for palpebral conjunctiva and the iris and the pupil. So, John, I'm going to palpate your lacrimal ducts and lacrimal glands. Can you close your eyes? Okay. So, there's no edema, no swelling, and trying on the lacrimal ducts. Okay. So, I need you to look up for me to check for the bulbar conjunctiva and sclera. Look up, please. Okay, look up. Okay. Okay. Can you look down, John? Okay. Look down, please. Okay, and I'll be inspecting your iris. Can you look at me? Iris and pupil. Look straight into my eyes. Okay. So now I'm going to assess for the direct and the consensual pupillar reaction to light to determine the function of the third cranial nerve. So John, I'm going to turn off the lights and I'm going to use my pen light again in your eyes to check for your direct and consensual reaction. Okay. So what I did, John, is I showed light in your eyes and it constricted, and that's the direct reaction. And for the consensual, it means when I show the light on your right eye and left eye also constricted, and that's pretty normal. So let's proceed now to check for the pupil's reaction to accommodation, to check for the patient's eye to focus. So what I need you to do is to focus your eyes on the tip of my pen light and then look on the wall at my back. Okay? Pen light, the wall, pen light, the wall. Okay? So now I'll be performing the Hirschberg test to detect strabismus. And basically, John, I'll just shine my pen light on your eyes and look for the reflection of it on your cornea. So, okay, just look straight. Okay. Okay. And now I'll be performing the cardinal field of the gaze test to determine your eye alignment and coordination. So I need you to follow the tip of my pen light with your eyes only. Don't move your head, okay? Head and neck. Don't move your head and neck. Just use your eyes only, okay?
Okay.
Okay. Okay. Okay. Okay. Okay, so now I'll be testing for the convergence. If there are no abnormalities or troubled focusing, just simply follow the pen, okay? Okay. 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 Okay, so John, now that we're done on the assessment, I'll be summing up everything that we've covered. So for your visual acuity, when you read the Snellen chart, your right eye is at 20/50, and your left eye is at 20/70, and your both eyes are at 20/50, which is why you have difficulty in reading something far away from you. And as you said a while ago, right? And for your visual field, when I was moving my fingers, your upward field is at 50 degrees and the downward field is at 70 degrees. And the nasal field is at 50 degrees, which is, it is normal. And for the inspection of the eyes, and your eyes are aligned symmetrically, your eyebrows are evenly distributed, eyelashes are evenly distributed also, and curls are slightly upward. And your eyelids, skin is intact and are closed symmetrically. No discharges and no discoloration, and you have normal blinking, which is at 15 to 20 blinks per minute. And as I was palpating for the lacrimal glands and ducts, there was no edema, tenderness, swelling, or tearing. So that's it so far. Your eyes don't have any problems aside from having blurred vision. I'll just advise you to minimize using your cell phone and laptop or exposing eyes to anything that has ultraviolet rays for a long period of time. Your sclera is white as well as your bulbar conjunctiva. The pupils are both normal and there are no opacities, and there are at least 3 millimeters, which is normal. Your pupil's reaction to accommodation is normal too, and your corneal light reflex is normally centered on both pupils. And cardinal field at gaze test, there are no jerky movements on your eyes, and both eyes are coordinated. I think that's it for the assessment. Thank you very much, and have a good day. Yay, thank you, sir.